This video is about the respiratory system. The respiratory system, breathing in oxygen, getting rid of carbon dioxide, and the organs that are involved. So here are some of the respiratory organs. They're divided into upper respiratory tract, lower respiratory tract. The upper respiratory tract, nasal cavity, your pharynx, that's your throat, and the lower respiratory, your lungs, trachea, bronchioles. The diaphragm is a muscle that goes across the bottom of your rib cage. When that muscle flexes, it increases the volume of your rib cage, which allows air to rush in to the respiratory system. Respiratory structures are meant to help get rid of carbon dioxide, take in oxygen. So there's external respiration. That's the exchange that's happening all across the alveoli of the lungs. Remember, alveoli are these little pockets in your lungs, and they have a squamous epithelium, very thin epithelium around them. So it's easy for oxygen to diffuse across. Then we've got this transport that's going around your cardiovascular system. And then we have internal respiration, which is going from the blood cells, dropping off oxygen to the tissues that need it, and picking up carbon dioxide to carry back to the lungs. When you inhale, air is going to go through your nasal cavity first, then your mouth, down the trachea, from the trachea to the pharynx, then the bronchus are the larger tubes, the bronchioles are the smaller tubes, the alveoli, and the capillaries. When you inhale, air comes in through your mouth or through your nose. It goes to the back of your throat, that's your pharynx, down your trachea, that's your windpipe, into this large tube in your lungs, the bronchus, and then smaller bronchioles to these little tiny sacs called alveoli, and then into the capillaries. Breathing through your nose has some advantages as opposed to breathing through your mouth. Breathing through your nose filters the air because of the cilia lining your nose and the mucus that can help collect dirt and dust and debris. It also warms your air in the sinus cavities, and then it moistens the air. So warm, moist, filtered air has no problem getting across the surfaces of the lungs and into the bloodstream. So there's some benefits to being a nose breather. Your airways, especially in your upper respiratory system, are lined with cilia. Cilia help trap dirt, dust, and debris. But cigarette chemicals destroy that cilia, which prevents some of that filtering. And then some people develop what's called a smoker's cough. They're always trying to hack up some dirt or dust particle that got into their airways, where the cilia would normally just kind of move it with the mucus out of your airway and clean it for you. So one of the downsides about smoking is developing smoker's cough. Your airways aren't able to be filtered as well. Another downside, of course, is lung cancer. Here's an example of lung cancer. You can see all the tar build up in the lung. The white part there is the cancer that's growing. And it certainly inhibits your lung function because the cancer cells are preventing that oxygen from getting into your body and the carbon dioxide from getting out. You have these pockets in your skull called sinuses. So the bones form these little pockets. They help lighten your skull. But you might feel a sinus headache as that pressure builds up when mucus starts to accumulate in there. Changing of seasons sometimes does that. A cold will do it. But there's sinuses are just pockets that help lighten your head, but also warm and filter that air, moisten it. In the back of your mouth, you have this little structure that hangs down called the uvula. Whenever you swallow, that uvula will be pushed up, and that blocks the nasal cavity from food getting and liquids getting into the nasal cavity. Your windpipe gets blocked by the epiglottis. So as you swallow food, that food pushes the epiglottis down over your trachea. The food goes down your esophagus, and food and liquid don't normally go into your trachea. So you've kind of got two structures. One's the uvula, which folds back like this and covers the nasal cavity. The other is the epiglottis, which folds down like this and covers the esophagus, so that it's keeping food or keeping air, it's keeping food and drink out of your airways. The larynx is your voice box. So if you've ever heard of laryngitis, it's just an inflammation of your voice box. It's irritated, and those vocal cords aren't able to flex like they normally do. Vocal cords are kind of like rubber bands. When they stretch, the pitch goes high, and when they're loose, the pitch goes low. Laryngitis is just whenever those cords are irritated, then they don't stretch as easy, and you can't get much sound out of your voice box. The trachea is a tube, but it has cartilage plates. It's not one big shield of cartilage. There's gaps in between. That allows for some flexibility, but it also keeps the trachea from collapsing. Whenever you inhale, there's this mass of air moving through, which creates a vacuum, and if without those cartilage plates, it would just collapse in, and then no air would be able to get in. But those cartilage plates keep it open so that air can rush through your trachea. Those gaps then provide a way that if there is a blockage in your trachea, the tracheotomy is just sticking a tube in between those cartilage plates so that air can pass in, even though it's unfiltered air. Sometimes people get things stuck in their trachea. The Heimlich maneuver is a way to use some of the pressure, the air that's in your lungs, and that pressure to push that object out and hopefully expel it. The bronchi form a tree. This is a set of lungs that are upside down, and you can see it looks very much like a tree. Asthma causes constriction of those bronchioles. So whenever there's an allergic reaction or maybe exercise induced, those bronchioles shrink up, which makes the air much more constricted, and it's much more difficult to breathe. So the breathing comes short and shallow, and a little antihistamine or a little allergy medicine from an inhaler can open those airways up again. Non-allergic are things like cold air, exercise. Sometimes that causes the bronchioles to constrict. The alveoli are the last stop in the lungs. These little tiny pockets that are lined with a lubricant called surfactant. Now, respiratory distress disorder is where there's not enough surfactant. So without that lubricant, it's very hard to inflate those alveoli with air. Pneumonia is where there's too much surfactant. They start to fill. Your lungs start to fill with that fluid. Now, pneumonia itself is not a disease. It's a symptom of a disease. Breathing is regulated by levels of carbon dioxide. As carbon dioxide levels go up, so does your breathing rate. So carbon dioxide is the most influential chemical that regulates your breathing. So the reason you feel that stress, you want to breathe, is because carbon dioxide levels are very high. And that's being picked up by chemoreceptors, and that message is being sent to your medulla, and your medulla controls your breathing rate. But you can consciously control your breathing. That's controlled in your cerebral cortex. So your medulla is picking up information and regulating your breathing when you're not thinking about it, but your cerebral cortex can also regulate your breathing. Now, when the cerebral cortex is in control, you can hold your breath, but you can't hold your breath till you die, because you'll faint, and that'll shut down your cerebral cortex, but your medulla will still be working, and you'll start to breathe again. These are some common respiratory or breathing volumes. Tidal volume is just the amount of air you breathe in and out with each breath, like the tide, going in, going out. Tidal volume, how much air is going in and out with each breath. Total lung capacity is all the air that your lungs could possibly hold. Vital capacity is a deep inhalation and then a deep exhale. But the vital capacity is not the same as total lung capacity. And that's because every time you breathe in deeply or breathe out deeply, there's still a little bit of air left in your lungs, and that's called residual volume. So total lung capacity is your vital capacity plus your residual volume. Take a super deep breath, inflate a balloon. That's your vital capacity. But there's still a little bit of air left in your lungs to keep them from collapsing. Add those two together, that's your total lung capacity. Let's take a look at some respiratory disorders. In this case, you can see an individual who has cough, loss of phlegm, shortness of breath. Now notice how long they've been coughing and wheezing. That's a good indication of bronchitis, a long-term inflammation of the bronchial tubes. Here's an individual that's complaining about a runny nose. They have a cough and sore throat, elevated antibody levels in the blood, and that's a good indication of the common cold. You'll notice that their temperature is pretty close to normal. This person is breathing secondhand smoke. They come into your clinic coughing, spitting up blood, anemia, that's low blood oxygen levels, even lost 15 pounds. That's a pretty good indication that they have lung cancer, and they got it from their spouse and the secondhand smoke. This individual has awoke up on Sunday feeling achy. They present in your clinic with a constant cough and headache. The elevated antibody levels, the temperature, gives an indication that they're experiencing flu symptoms. This person has a very low forced vital capacity, raspy sounds in the lungs. That points to pneumonia. Their lungs are filling up with fluid instead of with air. This individual has been a chronic smoker. As a result, their alveoli are breaking down, which means there's less surface area for gas exchange. That's symptomatic of emphysema. This person complains that cold air hurts her throat. Her throat's been sore for a long time. The lymph nodes are swollen, so the throat hurts to be touched. And that's a great example of streptococcus, strep throat. Those are bacteria living in the throat. This person, having gone to the Philippines, has probably picked up something from that island nation. And in this case, it's symptomatic of tuberculosis. I hope that helps you understand some things about the respiratory system, some things about respiratory disorders, and some of the structures of the respiratory system.